Today I will talk about causal survival analysis. This is part of my series of lectures on cause and effect modeling. First I will give introduction, then I will describe Python code, and then I will mention few further reading articles. Often we are concerned with estimating treatment effect on the expected time until the occurrence of an event. This is called survival analysis. When coupled with confounder adjustment, it is causal survival analysis. So difference between survival analysis and causal survival analysis is adjustment of confounders. Causal survival analysis is a statistical method used to estimate the causal effect of a treatment on the survival time of a patient. It is used in clinical trials to evaluate the effectiveness of new treatments. It is also used in observational studies to identify risk factors for disease. Cox proportional hazard model has causal meaning if we apply Cox after adjusting for all covariates, traditional Cox, or after weighing by IPW method or causal model. Causal Lib is a Python package that provides a causal analysis API unified with the scikit-learn API. It includes a number of methods for causal survival analysis, including Cox proportional hazard model, Allen additive hazard model, Nelson-Allen estimator, Kaplan-Meier estimator. It also includes a number of methods for causal inference, such as propensity score matching, inverse probability weighing, doubly robust estimation. Now, Python example. First of all, we will load the data from the causal lib package. Here we have list of variables or confounders, the treatment variable, the time variable, and the outcome variable. Outcome variable is either the occurrence of interest event or censoring. So this data include 1629 cigarette smokers who were aged 25 to 74 years at baseline and who were alive through the year 1982. All these individuals were then followed for a period of 10 years, in which 318 of them died before the end of the year 1992. So the survival time of the remaining 1311 individuals is censored at 10 years. Treatment assignment was smoking cessation status, with A is equal to 1 indicating quitters and A is equal to 0 indicating non-quitters. So this is our data set with these variables, many of which may be confounding variables for our study. So the basic analysis is, so this is the outcome variable, which is either the occurrence of an event or censoring. An event here is death. And A is the treatment variable here, which is quitting status. So this is the cross tabulation of our these two variables, outcome and treatment variable. And this is the one of the confounder, age may be one of the confounder. So this is the summary of variable age among quitters and non-quitters. So we see that 26.3% of individuals quit smoking, of which 76.17% survived at 10 years. In contrast, 82% of the non-quitters survived. So this is actually surprising that more individuals among the non-quitters survived as compared to those who quit smoking. Let us evaluate the marginal survival. This is actually a code for plotting of the graph, and this is analysis. So we have marginal survival analysis in causal live package. So we can see that quitters graph is below the non-quitters graph. So this is not expected from the logic that smoking is bad for health. So we can analyze the effect of confounding variable. We can estimate the weighted survival. We can use IPW, and for that we can use logistic regression as described in textbooks of causal analysis. So these are the variables uh, before weighting and after weighting. So when we assign weights, the all the variables, their difference in two groups is very less after application of weights. Before that, the difference was higher, especially in age and smoking years and smoking intensity and so on. So this is the weighted survival. So when we have adjusted for confounding, then the two curves they actually match. Now there is no difference between the quitters and non-quitters. Another method is standardization. So we can use standardized survival method of the causal light package, and the curve are again very similar. The difference which was there is not after standardization, and this is with uh, Cox pH filter, and the previous one was after using logistic regression. So there are further readings also on this topic. So this is an interesting article. This is DOI of this article by this author. The title is Causality and Cox Regression Model. Author proved that the simple Cox regression model is not actually a causal model, and we need to do extra for causality analysis in survival. And this interesting article, the URL is here, and it describes causal tree and causal forest, and also describes survival random forest. This is interesting. So anyone who is interested can read these articles. So this is all for today. Thank you very much.